Man.
Hello, my name's Emily. I'm a PA student and I'll be helping you today. I'm washing my hands. Alrighty, I'm gonna write a few things down and then we'll get started, okay? On my blank paper. Okay, now we can get started. So what brings you in today?
A sore throat.
A sore throat? Let's see. Can you tell me more about it?
It's been going on for about a week or two, and it just kind of burns when I swallow.
Okay. So I know you said it's kind of been going on for a week or two. When did the sore throat start?
About 2 weeks ago.
And is it just your throat that's sore?
Yes.
Can you tell me the location?
More like in the middle.
Middle throat. And I know you said it started about 2 weeks ago. Have you had it every day for the 2 weeks?
Every like once in a while.
Every once in a while. And I know you said it burns when swallowing, but can you explain how it feels to me?
It's kind of like when I swallow, it just like feels like there's spikes in my throat.
Okay. And are you having any other symptoms with your sore throat?
No.
No. Does anything make your sore throat better?
Sometimes when I drink water.
Water. And does anything make it worse?
Whenever I like eat like big things and I don't like chew it enough and just swallow it.
Okay. And does the pain or soreness radiate?
No.
No. And has it been pretty constant or does it come and go, your sore throat?
It comes and goes.
Comes and goes. And on a scale of 0 to 10, 0 being no pain and 10 being the worst sore throat you've ever had, can you rate your pain for me?
7.
7. And have you ever experienced this before?
No.
No. Okay, now I'm going to ask you some general questions. You can just answer yes or no to these. Have you experienced any fever?
No.
Any chills?
No.
Have you felt fatigued?
No.
No. Have you had any general discomfort?
No.
Any general weakness?
No.
No. And have you had any recent appetite or weight changes?
No.
No. All right, now I'm going to ask you some questions pertaining to your eyes. These as well you can answer yes or no to. Have you experienced any burning?
No.
Any blurry vision?
No.
Have you had any changes in the sharpness of your vision?
No.
Have you had any dryness of the eyes?
No.
Have you had any discharge from the eyes?
No.
Any double vision?
No.
Have you had any eye pain?
No.
And have you seen any floaters in your vision?
No.
Have your eyes been itching?
No.
Any sensitivity to light?
No.
Any redness?
No.
Any swelling around the eyes?
No.
Have you been seeing any spots?
No.
And have your eyes been watering?
No.
No. All right, now I'm going to ask some questions about your nose. These again you can answer yes or no to, okay? Have you had any changes in smell?
No.
Have you had any recent nosebleeds?
No.
Any obstruction in the nose?
No.
No. Have you been sneezing or having any sinus pressure?
No.
Have you had any discharge from the nose?
No.
And have you had any polyps?
No.
And have you had any post-nasal drainage?
No.
No. Okay, now we'll move on to some questions about the mouth and the throat. Again, these can be answered with a yes or no question. Have you had any disturbances to your taste?
No.
Any mouth pain?
No.
No. Have you had any dry mouth?
No.
Any unpleasant breath?
No.
No. Have you experienced any hoarseness?
A little bit.
A little bit. Have you had any bleeding in the mouth or throat?
No.
No. Any masses or lesions?
No.
Any ulcerations?
No.
No. And have you had a sore throat?
Yes.
And have you noticed any snoring, or has anyone noticed any snoring?
I don't think so.
No. Okay, now we're going to move on to some past medical history of yours. I'm going to ask you about 7 conditions, and I just want you to answer yes or no if you've ever been diagnosed with any of these or if you have any of these conditions presently, okay?
Okay.
High blood pressure?
No.
Diabetes?
No.
High cholesterol?
No.
Any heart disease?
No.
Have you ever had a heart attack or stroke?
No.
And have you ever been diagnosed with cancer?
No.
No. Alrighty. Have you ever been hospitalized?
No.
No. Have you ever had any surgeries?
No.
Are you up to date on all your childhood shots?
Yes.
Yes. And do you have any drug allergies?
No.
Any food allergies?
No.
Or any environmental allergies?
No.
No. And do you take any medications?
I take melatonin.
Melatonin? How often do you take melatonin?
Like during the week,
During the
not like the weekend, but like the weekdays.
And how many do you typically take at a time?
1 to 2.
1 to 2. Alrighty. Any other supplements or vitamins that you take?
No.
Any prescribed medications?
No.
No? Okay. Alright, now we're going to move on to some family history. I'm going to ask about those same, well, actually we'll start off with, are your parents living?
Yes.
Yes, both mom and dad.
Yes.
Can you tell me their ages?
In their 40s.
40s. And do you have any siblings?
Yes.
You do? Brothers or sisters?
Brothers.
How many?
2.
2 brothers. Can you tell me their ages?
6 and 13.
And both brothers are living?
Yes.
Okay. All right, now I'm going to ask you those same conditions that we talked about earlier. And I just want you to tell me yes or no if any of your family members that we just discussed have any of these, okay?
Okay.
And do you have any children?
No.
No children, okay. All right, back to the conditions. Anyone with high blood pressure?
No.
Any family history of diabetes?
No.
High cholesterol?
No.
Any heart disease?
No.
Has anyone ever had a heart attack or a stroke?
No.
And has anyone ever been diagnosed with cancer?
No.
No. Alrighty, now we'll move on to some social history questions. Do you use any tobacco products?
No.
No. Do you drink any alcohol?
No.
Do you use any illicit drugs?
No.
Can you tell me about your diet?
I don't have one.
No diet. And can you tell me about any exercise that you do?
I do cheer.
You do cheer? How often do you do cheer?
About every day.
Every day. That must be a busy schedule. Alrighty, and can you tell me about your living situation, who you live with?
I live with my parents.
Parents. And are you employed?
No.
No. Are you in school?
Yes.
What grade are you going to?
6.
6. And can you tell me about your finances? Do you have access to medication and?
Yes.
Yeah. And are you able to pay for all of your things?
Yes.
Yeah. Mom and dad help you with that?
Yes.
And are you sexually active?
No.
No. Alrighty. Well, today I was just practicing taking an ENT history, so that will be all for today. Thank you for your time. I'm going to wash my hands real quick. And that'll be it. Thank you.
Bye.